Last month marked 3 years that my mom had been on tube feeding due to inability to swallow from Alzheimer's. So fast 3 years have passed. In this video, I would like to give a brief of what the journey I've been through for the past 3 years and what you will have to look out for should you place your loved one, you decide to place your loved one on tube feeding. Tube feeding is not common to be done for people with Alzheimer, but unfortunate because in Thailand, they would actually put any elderly or people that are unable to eat, they will actually the doctor will prescribe an NG feeding tube. So in most cases, these tubes are only on temporary basis until the person recovers. But in cases of Alzheimer, it is known to be permanent basis. And my mom has been on the feeding tube for 3 years. I would like to go through the journey and the learning that I have from placing her on a feeding tube. First thing first is that most of the time when a person is not able to swallow, they can still digest. So if they're placed in the feeding tube and they are able to digest the food, it's because it's only a problem with the swallowing reflex. So it's being taken care of by the feeding tube. This is being prescribed for patients like those who go through radiotherapy and on the neck and they are not able to swallow, or they have certain complications that causes them not able to swallow. They will be placed on a feeding tube first. Stroke patients and ALS patients, which is motor neuron disease, they are also placed on feeding tubes. And these are accepted practices, means for the stroke, ALS, and for other medical conditions. But somehow it's also commonly done for people with Alzheimer, even though the condition is similar. When you place them on a feeding tube, if their digestion system still works, the food will be absorbed and digested. Then when you check again before the next week, you'll find that their stomach is empty and you will be able to feed them again. But one of the things that you will need to take note when you are placing a loved one on feeding tube, be it due to they have stroke or they have ALS, because the fact that if they are on feeding tube, it is problem with swallowing. So if they can't swallow food, chances are they also have problems swallowing their own secretion and sputum, mucus, phlegm, and so on. So these secretions will gather around the trachea, sometimes it flow back into the lungs and around the throat area. And after a few days, this will harden into it hardens and it may block their breathing passageway, causing them to choke. This was what happened to my mom. Some people would not have that. Like there is another lady I know in Thailand, also she have Alzheimer. She's currently on a feeding tube. After a few years of having Alzheimer, she no longer able to swallow. So she's placed on the NG feeding tube. Few months she still don't have any phlegm problem because the caregiver still give her a sip of water twice a day to actually make her not to forget how to swallow. So she would still remember how to swallow her own phlegm and saliva. The only thing is that she's not consuming enough to sustain her life. That's why she's on the feeding tube. In the case of my mom had phlegm problem, which is something that she already had for the past 20 over years, because for about 24 years ago, my mom had tonsil cancer and undergo radiotherapy treatment for it. So she does have like irritation and she will have like very solid secretion from her throat because of the irritation. So with the NG tube and losing the ability to swallow, she also had that problem. Initially, I didn't understand what was happening. we brought her to the hospital, and finally the doctor actually recommended that we do suction. So I slowly learned to do suction by myself. Luckily, there was someone who had a basic knowledge of suction, taught me, and then from there, as I do suction repeatedly, I learned. And when my mom was hospitalized, I also see how the nurse do it, and I ask questions, and then from there, I slowly learn. One thing is that if that person, like your loved one, be it a stroke patient, ALS patient, or Alzheimer person, or anyone who is elderly on tube feeding and they can't swallow, if they have phlegm and secretion with recurring pneumonia, lung infection, because there's only so much oral suction can do. The suction means you pass the suction catheter into the throat, into the trachea area to do the suction. The suction tube will be blocked by their voice box, so they cannot go through, and you cannot reach deep enough. So if there's a phlegm gather around outside the right at the opening of the lungs, it cannot be suctioned out by suction. You cannot reach deep enough. Actually, my primary care doctor had been trying to tell me that, and he recommended tracheostomy. But because I have a lot of fear about tracheostomy, about wound dressing, about infection, about the fear that my mom having Alzheimer may pull out the trach tube from her throat, causing bleeding and blah blah, I was very hesitant to have the procedure done. So this is one of the lessons I've learned, that if let's say your loved one always have that choking because of the phlegm, even if you do suction, if you don't do suction, is detrimental, because they could die from choking, and it's a very terrifying to watch, unable to breathe. You literally watch their lips turn blue, and their eyes roll upwards. It's very, very scary sight, and they are gasping for breath. Buy a suction machine and learn to do the suction. Get the nurse to teach you how to do the suction. If you want to be on a safe side, you may want to consider a tracheostomy. Tracheostomy is often done for ALS patients. For people with motor neuron disease, means ALS is a disease, a motor neuron degeneration, which until today, nobody knows the cause of the illness. It strikes mostly healthy people, young people, like people who run marathon, triathlons, have a healthy diet and lifestyle, they can get ALS. So for them, right, the moment they are being diagnosed with ALS, they would actually do two things. This is what I learned from the private support forums in ALS. And why I end up in ALS support forum is because I could not find any information on feeding tube for Alzheimer. The only information I can find about feeding tubes is in ALS forums. Very rich information in ALS forums. That's why I ended there, and then I started to learn a lot about that illness when I was in the private discussion Facebook groups. So this, when they are being diagnosed, it's very common that they will do two things. They will actually have a procedure done to put the feeding tube in the stomach, a PEG tube. Means instead of putting the nasogastric, they'll put a PEG tube. Even people with related with illness such as gastroparesis, the digestion system is not working, it's not digesting, it's like their digestion, their stomach have frozen. They also will have a feeding tube placed, but sometimes it's towards the at the intestines if they can't digest using the stomach. And they will have the feeding for LS. Normally, they will actually schedule a procedure to put in the feeding tube first, together with the tracheostomy being done later. Reason being is because one of the complications of ALS is that slowly they will lose the ability to breathe. So when they lose the ability to breathe and their body intake of oxygen is not enough, they cannot have the procedure done. It's too late already, because they will have to go under GA, means they will go under anesthesia. So if they knock them out and they don't have enough oxygen capacity, the surgeon won't perform the surgery because they may die. The chances of dying is very high in the surgery if their uptake of oxygen is not there. So normally these procedures are done very early. In the case of my mom, I have been going in because of she had about more than 2 years of recurring lung infection. I do suction daily, at least 4 times before her meal. I do the suction for her. And yet, there's, like my doctor say, there's only so deep that you can reach with the suction tube. You cannot reach deep enough to suck out the phlegm. Most of the time, I depend on her to cough out. But with the recurring infection, her lungs have weakened so much that eventually, after about 2.5 years, one of her lung collapsed. So she went into ICU, went into ER emergency, and then from emergency, the doctor said that she should be that there's nothing much they can do already. So, but the doctor gave the alternative of going to the doctor to tell us either we actually work on her end of life, means injecting morphine and just let her be comfortable, which actually, if there are a lot of cases, I don't think they're very comfortable because gasping for breath is a very difficult feeling. And sometimes even with morphine also, they show a lot of sign of distress. But I digress. The second option is that go to ICU, but the doctor didn't really recommend because the doctor didn't think she's going to survive. But we wanted, because seeing that when her lung had issue, my mom had been having low oxygen for long time because of this pneumonia. Even I have an oxygen concentrator with assisted oxygen for her, which I use on and off. I turn on the machine on and off, but it still eventually got to a part where it's no longer enough. When she's taking the oxygen through the nose, it's no longer enough. So, and yet she still could survive. Do you know that for the time she went on tube feeding, 3 years, we can't really get a measurement, means her BP, her blood pressure cannot be measured from her arms. The machine will hit error. We have been doing measurement using her calf, and yet she still survived. So it shows that my mom, in her own way, she wanted to live. And as children, we have to honor that. So what happened was that we just took her when she was in the ER during that time with the collapsed lungs, and doctor didn't think she's going to make it. But the doctor still say that one other option is you can send her up to ICU, put in the ventilator, and then eventually he had to do the tracheostomy. So we opted to place her on the ventilator because we are thinking that if she's not going to make it, then let her go with enough oxygen and not die gasping for breath. With the help of the ventilator, let her go with oxygen. We don't want her to suffer gasping for breath because it's a very terrible sight to see. The moment they put the ventilator inside and they place and then they wheel her up to ICU, I saw the change in her face, relief. And because the ventilator is helping her to breathe, so she's no longer gasping for breath. So she had a look of relief on her face. And then I knew that I did the right thing. After about this happened last year, October, about slightly more than 2 years and 4 months after she had been placed on the feeding tube. Because of the recurring lung infection due to not able to swallow the sputum. After she went to ICU, 3 days later, the doctor called me. The doctor told me that the ICU doctor recommended a tracheostomy for her. So I was concerned because she will go under GA, means anesthesia, and then I'm afraid she can't make it. The doctor told me. After she had been put in the ventilator, she is doing better than most of the patients in ICU. means that she's showing sign of recovery better than most of the patient, and they don't want to have her in ICU for too long because not enough space, and also they will try to procedure to save the patient. So she recommended tracheostomy because from the record, this is something I want to share with you, because if you have a loved one going through that situation, you may want to consider that as well. She recommended a tracheostomy because she said that if you're going to, because the phlegm we cannot pull out, if let's say they is very deep, and the phlegm will harden and cause recurring when you can't pull it out, sometimes it go back into the lungs, it causes recurring infection. So she told me that you will have to keep coming back to the hospital and hospitalizing her because of this condition, which was what happening. And she said that tracheostomy can solve the problem. At that point, my mom was already in critical condition. I have nothing to lose already, because I know if she have another pneumonia attack again, I don't think she's going to make it. At the rate her lung has been so weakened. And they also picked up something when she was in ICU, is that her heart had been enlarged. There have been fluid built up in her pericardium, because we suspected it's because her heart had to work harder to pump oxygen into the body, because the body had been having insufficient oxygen for so long. Actually, my mom had low oxygen for so long, and somehow she's still able to survive. So it is sometimes how the body works, we really cannot comprehend. It doesn't. It defies logic. But anyway, because there's nothing to do, so I agreed to the procedure I signed the papers to have a tracheostomy done. So the plan was that after they do the tracheostomy, then they're going to do the suction. From there, they will suction out the sputum in her lungs, because when they put the ventilator, they couldn't do the suction. They had to save her life first. So there was a lot of, she had very severe pneumonia from this secretion that is in her lungs. So after they do the tracheostomy, they were going to do the suction out. Then the doctor told me she will be transferred to a semi-ICU unit. Semi-ICU means that you don't need a one-to-one person to monitor all the time. No one is allowed to visit her when she's in ICU or semi-ICU. But the plan is, while weaning her off the ventilator, they're going to put her in semi-ICU if they see that she's stabilized. So that was a plan. And then she had the tracheostomy done. After the tracheostomy was done, they did the suction out of the phlegm. Within a day, they were able to wean her off the ventilator. Means that she don't need to use assisted breathing anymore. She could breathe on her own, but she still needed high dosage of high dosage of assisted oxygen. Means they have the oxygen, they connect to the trap with assisted oxygen going in. But she was able to breathe on her own. So because she could breathe on her own, they don't need to put her in ICU anymore. They directly move her back to common ward. Once she finished her antibiotic, they plan to discharge her already. The antibiotic was for her pneumonia, via intravenous. But then, seeing her condition is not stable and that my mom will require assisted oxygen according to the nurse, we need time to prepare. And we also, because from when you put in IV for the patient, right, you put in drips, especially elderly, and their veins are not very good, they will be bloating, they'll bloat all over the place. So I just want her to stabilize. So I requested to move to a private room where I pay. At the same time, for the nurses, because in the common ward means you have all the beds, and then just limited nurses running around. They don't have time to teach you, and the environment is very noisy. There's no air conditioning. And she already had bed sore when she stayed in ICU. So what happened? Well, I arranged to move her to a private room. I pay. And then I got the nurses to teach me how to do tracheostomy dressing, how to do suction. And in the beginning, of course, you can't do it. You can't learn like one or two lessons, one or two. I stayed there for about 2 weeks. The doctor was trying to chase me off, but I actually pleaded with the doctor to allow me time because I wanted to learn how to take care of her properly before I take her back, which turns out to be the right decision because in the span of about 2 weeks of staying there, I encounter various situations and I ask questions. Whenever there's something I don't understand, I ask. The nurses will tell me, will explain to me because they are able to give more personalized attention and they are able to teach and allow me to do it myself, and they stand and watch and do it myself. So happened the ward that the private rooms were quite empty, the occupancy was not full, so the nurses had more time to teach me. Then when I come back, I was able to help her along. And I've been bringing my mom for, this is now how many months? She had this procedure done about 8 months already, tracheostomy, and it really saved her life. So my regret is that I had let fear hold me back. I have let, when I ask people, people in my country, oh no, don't do, because it's not a common thing to do this tracheostomy, But but the ICU doctor said you can always stitch it back if you don't want, It's not to say it's permanently going to be a hole in the throat. If at any point of time you decide you don't want, you can always stitch back the hole, the tracheostomy opening in the trachea. So I had nothing to lose at time. But if I had done the procedure earlier, I would have saved my mother years of suffering from recurring lung infection. Because now, whatever phlegm she has, I will be able to do the suction out like immediately. And then her lung is, but she's using assisted oxygen, means I already have oxygen concentrator of 5 liter, but that is not enough. I actually bought 2 10-liter oxygen concentrator because with the tracheostomy, she also requires assisted oxygen. Cannot breathe on her own already because of her lungs is very weak. So we have 2 machines, 2 oxygen concentrator. Why we get 2 machines is because the machine is going to heat up and they cannot run non-stop. They're not like aircon, they can run non-stop. But this machine, they cannot. You have to rest them every 8 hours. But normally I rest them earlier because I want the machine to last longer. You have to this machine, you will need to turn them on for about 8 hours, the most 8 hours, then you have to switch. And this machine runs on electricity. So in the event of no electricity, we also have 1 big oxygen tank and a smaller one, because oxygen tank from the oxygen will only last about a day. It's very fast. So you can't be changing the oxygen tank is actually very heavy. So if a person required to be on oxygen on long term, then it's better to get the oxygen concentrator. But because oxygen concentrator runs on electricity and they can be like no electricity suddenly, right? Either you have an inverter or something that can store electricity and auto, like what the hospitals is doing, and they will auto generate electricity when there is an electricity outrage. If not, then have an oxygen concentration tank as well on standby, which I have used a few times when there is electricity disruption in my place. So this is how overall the journey has been. Again, the lesson is that my regrets, I should have done the tracheostomy earlier. I shouldn't have let advice from hold me back, because a lot of advice, Thailand are very good with dealing with this kind of situation. That's why the doctor just recommended tracheostomy. The ICU nurses and the doctor also told me that it is going to really help her. But because of fear, I let it hold me back. It's just a matter of learning how to do the dressing. Doing the dressing is very, you have to change the dressing, the wound dressing daily, which after a while when you do it, it becomes very easy. Like now I can do it in under 10 minutes to change a dress, clean, and then change the dressing. So it's not something difficult to do, and the suction can be done very easy. The moment they cough out, the phlegm just move outside their lungs a bit, you can suction out already. So my mother no longer chokes, because if she chokes, right, like she have a lot of phlegm and I happen to be asleep or something, she will be able to push out the phlegm, because through a cough reflex, she will be able to push out through the trachea tube. So because the trachea tube, there's an opening, so you push out, and then it will land on the dressing outside, the gauze dressing outside the tube. But at least she will be able to push out herself, as opposed to last time when there was no track tube, and then the phlegm just hardened and block her from breathing. So there's a huge difference. And this tracheostomy procedure is being done for any complication from people that have problem with breathing as well. In my mom's case, it's actually combined with her Alzheimer, and it has worked out very well. When I take her to the hospital for follow checkup, a lot of nurses is able to recognize my mom, because my mom have been in and out of hospital for the past 2-3 years, and going into like many wards and divisions. They are very happy to see my mom, to see that she has gotten better. Whereas from last time, before the tracheostomy, I used to take her when she looked as though she's in distress, because she was very loud moaning sound, because of she's unable to clear the secretion, the hardened secretion from her lungs. So when she breathes, it's like very huge, loud snoring and wheezing sound. So it's quite pitiful. Now she don't have the wheezing sound, partly because when you do the tracheostomy, it actually there's an opening, so no longer have the sound, and she can actually push out the sputum, the secretion herself. Going forward, I will try to share more on the things I learned, more specific on caring with assisted oxygen and tracheostomy.